Hello, everyone, and welcome to our Grey Bruce Schools and COVID-19 update presented on YouTube Live. Thank you very much, all parents, guardians, and hopefully some students coming to learn a lot about COVID and school health updates. With us this evening, we have a long list of guests. So I would like to introduce first Sue Patterson, our Board of Health Chair, Ann Eady, our Board of Health Vice Chair, Lori Wilder, Director of Education for the Blue Water District School Board, Gary O'Donnell, Director of Education for the Grey Bruce Catholic District School Board, Jean-Paul Gauthier, Superintendent of Education for Providence Catholic School Board, myself, Ian Reich, Public Health Manager, Drew Ferguson, as well, our Communication Director here at the Health Unit, Jillian Jordan, our Public Health Manager for the School Health Team, and Dr. Arra, Medical Officer of Health for Grey and Bruce counties. To start our event, I do want to start with a general acknowledgement for our First Nations partners within the area. So we will begin this event by acknowledging that we are meeting on Aboriginal land that has been inhabited by Indigenous peoples from the beginning. In particular, we acknowledge the traditional territories of the Iroquois, Ojibwe, Chippewa, and Anishinaabe. This territory is covered by the Upper Canada Treaties, and we recognize and deeply appreciate their historic connection to this place. We also recognize the contribution of Métis, Inuit, and other Indigenous peoples have made, both in shaping and strengthening this community in particular, but also our province and country as a whole. So before we get started with the content of this evening, I did want to allow our guests to provide a general introduction to the entire group. So to start things off, I would like to pass it over to Sue Patterson, our Board of Health Chair, for some introductory comments.
Thank you, Ian. Okay, so I have...
You're good.
All right, so hello everyone, and hello to our viewing public. On behalf of the Board of Health, I want to thank everyone for coming together to share information and answer questions about COVID-19 and our schools. Communication is key for all of us to get through this pandemic. The Board of Health and the Grey Bruce Health Unit rely on the support of our community to ensure a coordinated and successful response to the pandemic. Every day, families, school staff, and administrators continue to do the right things that help keep this pandemic at bay. It is because of that commitment we have safe schools. So I want to thank parents and school officials and staff for their efforts to ensure safe schools. It is not easy, but together we will get through this. Thank you.
Thank you very much, Sue, for those wonderful comments. And now we will pass it over to Ann Eady for some general remarks as well.
Thank you. My name is Ann Eady, and as the recently elected Vice Chair of the Grey Bruce Health Board, it is my honor to also welcome parents, students, representatives of our school board, and other interested viewers to this information session. As Sue said, education information is key, especially in a pandemic. So I just wanted to say, as a former teacher, I won't say how many decades ago, I have great empathy for our school board and our schools in Grey Bruce during this pandemic. I thought I was doing well to survive some weeks at school, and now I think I was pretty lucky compared to what I hear some parents and teachers and students tell me. But anyway, the good news is we do have excellent leadership on all levels, including the Grey Bruce Health Unit and staff and the school boards and parents. Parents, you deserve a lot of credit. I have two sons. One's a teacher and of course the other one's a parent as well. They're both parents. And it's not easy. It is difficult. But the good news is we can get through it and we have the expertise. It's just all about collaboration. So I am here tonight mainly to listen and learn as a member of the Health Board. So thank you very much.
Thank you very much, Anne. And I will now pass it over to Lori Wilder to welcome parents, families, and students from the Public School Board.
Thanks, Ian. On behalf of Blue Water District School Board, our trustees, families, senior administrative team, and staff, I would like to thank Dr. Arra and his dedicated team at Grey Bruce Health for organizing and hosting this session for parents, guardians, and students in our local school boards. With the recent return to in-person learning for many of our students and staff, the topic of safety in our schools remains an important one. While I know many students and staff are happy to once again see each other and participate in learning at school, there are understandably still questions. Please know the well-being of all of our students and staff, your children, is paramount for us. We are extremely appreciative of the continued support, advice, and expertise of Dr. Arra and the public health team in proactively keeping us informed with the most up-to-date information and to guide our school and work site health and safety protocols. Our relatively low COVID case numbers in Bruce and Grey counties speak volumes about the high level of diligence by our local public health partners and the efforts of you, the parents, students, guardians, and everyone in our school communities. We are very fortunate to be in this positive position, and each of us continues to share a vital role in our ability to stay the course along this trajectory of success. I look forward to this evening's session, which I know will be helpful in answering our questions and better informing us on what all of us can do locally to maintain our current favorable position. Thank you for joining this conversation and for all the support you have been providing to your children throughout these different times. Thank you again to Grey Bruce Public Health for making this opportunity available to all of us, and welcome to our many families from across Bruce and Grey counties who are joining this evening. Thank you.
Thank you very much, Lori. And I will now pass it over to Gary O'Donnell from the Bruce Grey Catholic District School Board for a welcome message as well.
Thank you, Ian. Good evening, everyone. On behalf of our Board of Trustees and our Chair, Lori DeCastri, and our senior team, I want to thank Dr. Arra and his team at Grey Bruce Public Health for their continued work and support during this COVID-19 pandemic period. Your continued support and openness to meet and dialogue has been essential to keeping our schools open, but most importantly, keeping them safe. I'd also, like Lori, like to thank our families and students for their continued support and patience as we have continually had to navigate this pandemic period. It has been a challenge to ensure the continuity of learning, but with your patience and support, we have moved from in-person learning to virtual learning and back to in-person learning. Your support has been amazing and greatly appreciated by our school district. The safety of our students and the safety of our staff guides all of our decision-making. I also want to thank and acknowledge the work of our staff. Since March 2020, the only constant in education has been change. They have shown great resilience and perseverance in adapting to the ever-changing dynamics of this pandemic to ensure that our students get the best education possible during these very uncertain and challenging times. They have moved seamlessly from in-person learning to virtual learning and back again, and we thank them for the grace with which they support their students during these most challenging times. Thank you again for joining this conversation. Thanks.
Wonderful. Thank you very much, Gary. And last but not least, I will pass it over to Jean-Paul Gagné, Superintendent of Education for Providence Catholic School Board, for some general remarks as well.
Thank you, Ian. Bonsoir. Good evening, parents, guardians, and students. As previously mentioned by Ian, my name is Jean-Paul Gagné, Superintendent of Education for Le Conseil Scolaire Catholique Providence. The school board basically responsible for French Catholic education in the Grey Bruce area. We are fortunate to have one school in the Grey Bruce area, which is Saint Dominique Savio. That's a JK through to grade 12 school. I look forward in continuing to work closely with the Grey Bruce school health team under the supervision of Dr. Arra and other local partners to ensure that all health protocols are implemented and respected within our school. Student and staff safety is our first priority, as this is essential to a positive learning environment. I look forward to participating in the town hall this evening. Thank you again for the invitation.
Merci beaucoup, Jean-Paul. Now, without further ado, I will pass it over to Dr. Arra for some more general remarks, as well as a general overview of the COVID situation here in Grey and Bruce. So without further ado, Dr. Arra, I will pass it over to you.
Thank you, Ian. Thank you, everybody. I have a list of people to thank, but before thanking them, I want to explain why I'm thanking them. And that's the most appropriate way to do it, because it's tremendous what people have done. The local situation in Grey Bruce is the reason I want to thank them. And today we have reported 0 new cases in Grey Bruce. That is without a doubt an accomplishment that everybody around the table has contributed to. We have no outbreaks in long-term care and retirement homes, no outbreaks in childcare, not in schools. This is as good as it gets for a pandemic of this caliber, pandemic of the highest caliber. We haven't seen something like this for 100 years. There is a lockdown, but all of us know that Grey Bruce has been in a relatively positive position that does not require a lockdown. The control we have over the pandemic has happened through the collaboration of everybody around the table here, and the bigger table in Grey and Bruce, and the public heavy lifting mainly. We have a new variant in the equation. Nevertheless, we have all the measures in place. The measures that have kept us safe would be necessary to be in place, and if there's a need to tighten them, we would. The guideline from the province has a list of measures to address this variant. When we looked at these measures, most of them are already in default in Grey Bruce at all levels. Schools are safer than homes. This is, the start of it. This is the bottom of it, the line of it. The schools are safer than homes, and that does not happen as a coincidence. The work of the school staff, the work of the parents before sending kids to school, during every thought about their kids, every action they have to prepare their kids to school, they have ensured the safety. The school staff work, the officials, the trustees behind all this work, that leadership. And I know it is the governance body that actually makes huge difference, because our board is an example of that. Mayor Patterson and Mayor Edie have been, with the rest of the Board of Health, the governing body for the success of our response as a health unit and as a public health team. You look at everything we've done here, all this success. It's difficult to use the word success with the pandemic just because it's a hardship. But we have achieved this, and we have achieved it through communication. Other countries, Asian countries, have controlled the pandemic, but we know what measures they've used. Welding doors to keep people in for 14 days. We barely used orders in a couple of cases, or the warning of an order. Most people have done the heavy lifting, the public, the parents, the schools, as I mentioned. And for that, I want to thank everybody around the table. Our board, the school staff, officials, trustees, the parents, every one of our listeners has done the heavy lifting to ensure the schools are safe. It's worth mentioning something there. 2 points. One, there is a vaccine around the corner. Pandemics, all of them end. That's a common denominator for all pandemics, and it's a good thing. But with the vaccine, they will end way sooner. The Spanish flu 1918 had 3 waves, or some reports would say 4. I have no doubt the second wave happened, but we have the vaccine right now, and it is around the corner. That will be the end of the pandemic. This is one point, and for that I want to finish this point with asking everybody to stay the course, to double down on the 3 W's. These are the things that kept us safe, kept our kids and the school staff safe And we need to double down on that. And the final point there to mention, it's the hardship and being kind, being calm. You would hear these words and sometimes people think it's a cliche, you know, like what is kind to do with pandemic? What's kind to do with infectious disease? It's very easy when people are under stress to turn around, try to point that stress or that hardship to somebody else, whether it's the visitor from the big city or whether it's the Amish and Mennonite and lower German speaking communities, or the other parent who does not want to do what we want to do. None of these people really cause the hardship. It's a pandemic. We really need to remember that. And we need to remember as a species, human, our success is directly related to the fact that we collaborate with each other. And you can see it in many examples in the success in Grey Bruce, but I can go to basics, the very common basic. If you take any other species in the wild, squirrel and the human, and you leave them in the wild for a year, the squirrel will enjoy their time. The human would not survive. But you take 100 humans and see what they will do. They will be a community and they will survive in any environment, in the cold, in the hot. They will go to the moon, and we have. So again, I would remind people it's a hardship, and the source of the hardship is the pandemic. So please be kind to everybody. And specifically, I can see it in different examples, but one of it is the mask use and anti-mask use. And we will get to this in some of the questions, I'm sure. That's one of the hot subjects where it shouldn't be. We have success to focus on and continue and celebrate. And those trivial issues, if we understand them as trivial, we can go a bit further. And I want to finish again by thanking everybody around the table, thanking the parents for the heavy lifting they've been doing, and the school and our board. Thank you.
Wonderful. Thank you very much, Dr. Arra. And now we will actually proceed with our normal schedule for the evening. So Jillian Jordan will do a brief presentation on the initiatives in place currently within the school system itself. So Jillian, feel free to introduce yourself and I will get the presentation ready.
All right, good evening, everyone. My name is Jillian Jordan. I'm the school health manager representing my team tonight. So we'll jump right into things and move on to the next slide. So I want to extend the welcome from our school health team. We're a group of 10 public health nurses with a wide variety of experiences, areas of expertise, and interest. And really what we're here to do in our COVID-19 response through the health unit in our school health team is to work collaboratively with schools and boards to ensure that schools are a safe place to be. So we do this in lots of different ways, whether it be directly while in schools through consultation on the phone with principals, families, as questions come up, or through helping in some of that background work to develop protocols, policies, and procedures to ensure that everything that needs to be done on those front lines are getting done. The goal of our program is to achieve optimal health of school-aged children and youth. And traditionally, I'm sure you're familiar with some of the work the school health team has done. This is largely sat with health promotion, things like healthy eating, exercise, substance use, some of the work that we do to ensure health across the lifespan. Given the new pandemic, we've kind of changed gears here at Public Health, and the work we're doing in schools does look a bit different. Right now, we're very much in health protection mode. And through that collaboration and partnerships with schools, we work to ensure infection prevention and control practices are in place and captured through all the different processes throughout the school. We also do surveillance, keeping an eye on what's going on in the community, where we're seeing cases, and making sure that students or families impacted by COVID have the instructions they need to stay home, isolate through our case management process. Outbreak management, or the management of cases in schools, is another large piece of the work that our school health team is doing. We're quick to identify when a case is identified in schools, and we work with the principals and boards to ensure that classes are dismissed in a timely manner and all the processes are in place to ensure that transmission stops there, so students can safely return once the time is right. So knowing that that's kind of the work that we're doing right now, I wanted to flip into the key layers of protection, or where we're focusing our work and what we're putting in place to make sure that schools are a safe place to be. For any of you that might work in workplace health and safety, this pyramid might be familiar to you. The hierarchy of controls are the things, like I said, we put in place to separate ourselves from the hazard. We know some measures work better than others, and we generally put the strongest measures at the top of the pyramid, with the less strong layers following underneath. However, we won't rely on just one layer and work to have as many in place as possible. So if one isn't working quite right, we have others to rely on too. So I thought we would just work our way down from the top of the pyramid to discuss some of these layers, as well as what each layer is comprised of based on our public health response. So we'll move to the next slide. So the best way we know to prevent COVID in our schools and ensure they're a safe place to be is through our broad public health measures. We want to stop COVID from ever entering the door of our schools. And the way we do that is through some of these community level prevention measures that have already been mentioned. Through staying home, reducing our travel, staying in our bubbles, and generally following the different rules put out by public health across the province, we're reducing our risk within the Grey Bruce area and driving our case numbers down, as was evident today in our report of 0 new cases. Additionally, vaccination is on the horizon. And as Dr. Arra mentioned, this is an exciting thing to look forward to stop the pandemic and remove COVID as that risk from coming into our schools. The other way we're stopping COVID at the door is through rapid case and contact management. This is where COVID cases are identified through testing and followed up with immediately through the public health case management team. We have a large group of public health nurses, dental hygienists, public health inspectors working 7 days a week to make sure cases are notified quickly and that all their high-risk contacts are notified, told to stay home. So if they do develop infection, they're not going to be coming to school. This goes closely hand in hand with screening and testing. Now, screening is something you're probably very familiar with as families, and I think a bit of a hot topic back when we returned to school in September. From navigating runny noses to fevers, are there 2 symptoms or 3? This is an important piece to the daily process of keeping COVID out of our schools. I think we owe it to ourselves, as well as our classmates, our teachers, and fellow families, to make sure we're doing the screening honestly. Going on every day to the public health or the Ministry of Health screening tool and filling it out, reading those questions thoroughly, and following the instructions it spits out at the end. If it's telling you to go get tested, go get tested. We're lucky to see that the turnaround times for the testing here in Grey Bruce have dramatically decreased. In fact, we're seeing some test results come back as quick as 24 hours. So if you're waking up in the morning and not feeling quite right, definitely head down to the assessment center, get tested, and with that negative result, you'll definitely have a greater peace of mind. And if it's positive, our case management team here will work through that process with you. There's no shame in a positive result. We just want to see that any follow-up is done appropriately and in a timely manner. The next layer of prevention is environmental measures. So these are things that are being done at the school level that actually change the environment. They're going to be things that are easily seen, like barriers, lines marked on the floor to ensure physical distancing, increased access to ways to wash our hands, hand sanitizer or soap and water, and things like cleaning and disinfection. These are the things that we work to put in place that are quite effective in preventing COVID from spreading if it does get into our schools. I'm sure you've noticed that classrooms look quite a bit different. The physical distancing that we look to put in place is one of the best measures we have. So we like to continue to emphasize the importance of staying 2 meters apart, whether that's in the classroom or outside with our peers, waiting for the school bus or playing at recess. So with these being some of our most effective measures, we like to layer them on as best as possible, as well as some of the other measures that are great, but not quite as great as these ones. So we'll move down the pyramid to the next slide. Administrative measures are changes to our processes or the things that we were doing before, how we modify activities like music class or the way we walk through halls. These are our processes and protocols. It's scheduling lunch at a different time so there aren't as many children trying to go in and out the doors to limit the interaction we're having outside of our little cohorts or bubbles of students where we know who we've been around and for how long. This involves levels of training and education, and lots of the communication we're having with schools through our school health team are around these things. Problem solving individual programs or processes to make sure infection prevention and control and COVID are considered in everything we're doing. Finally, the last line of defense, or the bottom of the pyramid, is PPE, or personal protective equipment. This includes masks, eye protection, and gowns. Now for students, most of us will be wearing masks. However, we will see the mask and eye protection for the teachers in our school. And though they are a great layer, we don't want to rely on them on their own. Being at the bottom of the pyramid, we know they can sometimes be subject to user error. Sometimes they're not on quite right. Sometimes we forget them at home. And that's why we pile on all those other layers in the pyramid to make sure if something happens with our masks, it's not our last line of defense. So that was a quick summary of all the things we're working on as a school team, collaborating with schools and school boards to have in place to keep our schools safe. And with that, we'll move into the discussion component of the evening, as I'm sure that's what we're really here to do tonight, is talk through some of these situations we're having here locally. So thanks for your time.
Wonderful. Thank you so much, Jillian. And you are correct. Your last slide there really did highlight a lot of very popular questions that we did receive. So we have collected questions over the past 4 or 5 days, and we've received a lot of great and challenging questions, which is wonderful to see. Because of the volume that we have received, what we have done is really compiled those questions into like topics. So hopefully we will be able to capture every single topic that has been asked about from those questions. If we do not get the time to get through all these questions, we are also developing a question and answer document that will go along with this live video once it is prepared. We will be sending it out to all the school boards, so they are free to send it directly home to all parents and families as well. But will also post it via social media on our Facebook page, as well as on our website for your availability at any time. So to start, I will start with questions regarding school reopening. So Dr. Arra, why is school open during a lockdown, and how is it safe for students to be at school during a stay-at-home order? Can you explain?
Certainly, that's one of the questions that repeat, and people intuitively think this is a contradiction. It actually goes hand by hand. The two together actually complement each other. The main goal of public health is not to lock down things. The main goal is actually the opposite, to open as fast as we can, as long as it's safe. And from the provincial numbers we've seen over the past few weeks, 3,000 per day, the provincial colleagues assessed the situation, and it required a lockdown provincially. The going into the main goal to open as fast as we can, if we have to open under a calculated measures, we would want to open the activities that are most important, the activities that are vital. And kids going back to school to have that educational experience, social experience, is one of the most important activities. So locking everything else to allow this activity to proceed safely is not a contradiction. It's actually complementary again. So that's the reason for it.
Wonderful. Thank you very much, Dr. Arra. Another question on a very similar topic. How can we deem classrooms as safe when there's not enough space to be physically distanced at times from other students, especially during places where masks maybe aren't worn, like nutrition breaks or something like that. Can you explain sort of the potential challenges with distancing and some strategies that maybe folks can take while they're at school?
Safety in schools, like I mentioned, schools are safer than homes. And I can answer this question from two angles. One of them is probably is easier to comprehend. We had the schools open in the first term for a few months, and the data, all of it shows that the school is a safe environment, safer than home again. And having that extreme difference in safety between the community and the school is a clear cut. We have the data solid for Grey Bruce. That's one way to look at it. The other way is having multiple measures of protection in the school. And Jillian's presentation outlined these measures very nicely. Having one of them will protect, having two will protect more, having all of them deployed, and the commitment from the school staff, commitment from the parents would ensure that safety. So having that physical distancing not ensured at all times, we already have ensured the screening before going to school to prevent people with symptoms. We ensured that there is contact tracing in the community to ensure people with symptoms or without symptoms have been in isolation. Hand washing, using a mask, all these things, added layer of protection. So not having that 2 meters or 1 meter in place 24/7 is not going to change the level of safety in the school.
Perfect. Thank you very much, Dr. Arra. One last question along that same topic is, are there specific triggers in place that would cause schools to close again? So we've just reopened. What would be a situation where you could foresee schools needing to close again?
Well, there are many scenarios in the pandemic where things might go off the rail. So far in Grey Bruce, we have been successful to keep them on the rail. One scenario, for example, if the variant changes that equation to a degree that there is community spread of the variant, and we are not able to have full control over the pandemic and the safety measures in different settings, we would move to something a bit more stringent, to modified access to school or modified learning or online learning. Nevertheless, in all these scenarios, the safety of our kids, the safety of people who are vulnerable in the community, the safety of school staff is not something we are willing to accept. Sorry, the risk to that safety is not something we're willing to accept. We will ensure that safety is in place.
Wonderful. Thank you very much, Dr. Arra, for those answers. So next, as discussed earlier, we did anticipate lots of questions about masks and wearing masks within the school environment. So I'll start with this first question is, when wearing inappropriate clothing, students sometimes get sent home. Why are they not getting sent home if they choose not to wear a mask? Wondering if you can just talk about sort of those risks and the reasons why.
That's, again, one of these hot subjects that they really should not be hot. And I will explain first why they shouldn't be hot. We have 4 or 5 months of experience of safe opening of schools. And during these times, during these months, there were families who chose that their kids should not wear a mask, whether because of medical exemption or because of whatever reason it is. Having a couple of kids in a class without a mask did not change the level of safety. You can appreciate there are multiple measures in place, like I mentioned, and the mask is one of them. And having 2 kids out of 20 without a mask, again, that's really, you put all these measures in place, it's negligible change. It's a very minimal change. And we have the solid data to see whether these 2 kids who are masked or not, the situation was safe. And I would ask people who are listening to just bear with me. I realize you might think I'm arguing against, and you're going to hear that I'm arguing for the science. We stand by the science. There is a different scenario here. There are a couple of reports of families who refuse masks, but they also participate in protests in different areas of the province. in areas where it is considered high-risk hotspot. And these protests would include gatherings without mask, gathering in close proximity. And that introduces a level of risk that we're not willing to accept in schools. This is not I'm talking about a bit different subject here. It's not wearing a mask or not in a class. I'm talking about participating in an activity that's high risk in a different area that's high risk area in the province. And with the variant, there is that extra added risk. For those families, their kids will not be able to go to school with direction from my office directly. I would not want to take that risk. And it's, again, not related to wearing a mask or not. It's related to participation in that activity. And the kids would be offered online learning, can go back to school after 14 days from their last participation in such protest or high-risk activity. So that's a category that's a bit different. If I go back to wearing a mask in class or not, if there is a medical exemption, and nobody should argue with that, would the family have to disclose to every other parent in Grey Bruce and to the school that we have a medical exemption? They don't. And that's where the guidelines would say, you would say, I have a medical reason, and you don't have to disclose more than that. However, it seems there are some families that are using the medical exemption excuse without medical exemption in reality. And that's where, if the school decides to ask for a medical note, it is completely within their ability, and I would support them with that. The new guideline, I'm going to finish with these 2 points. The new guideline used the word must wear a mask in school. The science, the recommendation from CDC Atlanta Center of Disease Control, is still stating that in schools in all ages, encourage wearing a mask. The word mandate should not be there. The best results by encouraging kids, and that's for multiple reasons. One of them is younger kids are not reliable enough to wear a mask correctly. Some older kids would have the attitude that if you say you must, you immediately lost more people than you gained. So the net benefit of mandating it is not there. It's actually the opposite. And the data from Grey Bruce, as I started, would support this. So you put it all together. If kids, if a family said, we don't want our kids to wear a mask, and we're looking at a class of 20, the best evidence in science is to encourage that family to use a mask. There is one more variable there. Again, it has multi-layers, and that's where the word must was there. You would find some outrage in the community, and outrage is a term and something we measure in public health. There is the real hazard, and there is the outrage, and the risk is related to the hazard. However, the management of the outbreak is related to both maintaining and managing the risk and managing the outrage. When you find in some communities in Grey Bruce that are parents saying, well, if the other family is sending their kid without a mask, I am not happy with that. And there are challenges that arise from that. In this case, the management of the school is within their complete right, according to the guidelines, to exclude that family. Again, it's not based on risk and public health recommendation for risk. However, it is based on the outrage management, and I would support completely the school with that decision. And if I can summarize it again, there are two categories here. There are people who are going to protests, and that's something I would completely not accept as a risk in the community, in the schools. And the other one, the discussion about the mask, and the school and public health will continue to collaborate and work with the parents to ensure this is ironed out in one way or the other. And if I step away from all this, we have a pandemic that we're managing, all of us, the parents, the school staff, school officials, public health teams, and mask use or not use in 2 kids in a class is really negligible. So I would encourage everybody around the table to focus on the bigger picture, on the variables that make difference, on ensuring screening is happening every single day, hand washing. These are the things that matter. I think of the analogy, and I was speaking with the communication team before this session. When I hear about the effort that's spent from everybody, from the parents, from the staff, from our team to respond to this anti-mask or mask use or not use in 2 kids, it's similar to the house is on fire and somebody's worried about the curtains closed or open. Let's focus on putting out the fire and let's be kind to each other. We can go way further. Sorry, and I belabored this question, but it's important to put people at ease.
Yeah, no, it was actually a wonderful answer, and you covered off 3 other questions in that response. So I think it was wonderfully done. So thank you very much. So the next question, it somewhat ties into to that as well. However, I think it does warrant a response of its own. So my child has developed anxiety about wearing a face covering or a mask. Is my child still able to attend school in person if they cannot tolerate wearing a mask?
So that's again one of the medical exemptions, and if there is anxiety from wearing a mask, there is no point of trying to wear a mask. The kid is not going to wear it correctly, and it's not going to achieve that added layer of protection for them or anybody else. But again, it's hard time, and everybody's anxious, and other parents might think this is a challenge not related to medical exemption. If everybody can just focus on the most important things, screening, hand washing, physical distancing, being kind to each other, wearing a mask or not might not be the bigger issue. And sometimes in the middle of emergencies and with people being upset, there are certain decisions that will be made, and that might not be accommodating to real anxiety that's not identified as real anxiety. Nevertheless, I believe the school system is able to provide education through online learning or through many other things. That kid can wear a face shield. That's another option. They can attend online learning, or if the school would allow them to be there without a mask based on a medical exemption, there are different solutions to this.
Wonderful. Thank you very much, Dr. Arra. Anyone from the board, do you have any comments about any of these mask discussions? Feel free to add some comments to these questions as well.
Sure. Thanks, Ian. I just want to thank Dr. Arra for his work and his time, and Jillian for lots of conversations as we work through these most delicate and sensitive conversations. I want families to know that each conversation is taken on its own merits. It's confidential, and it's a conversation between the principal and the family. And each decision is made on each individual family. And it is confidential. And it's important that it's confidential because it's ensuring that our students are feeling safe at school. So I would just encourage families to have those conversations with principals, and we can work through each of those. And as Dr. Arra mentioned, there are accommodations, and it's working together to ensure that everyone feels safe. So it's having that dialogue to ensure that we can find some accommodations, whether it's a face shield for a student who has sensory issues. There are just many options as long as we're in conversation and dialogue. So thanks for that, Dr. Arra.
I too would like to thank Dr. Arra for his conversation and sharing his thoughts with all of us. This, as Gary had alluded to, this is a very challenging situation in all of our boards, and we want to honor families with some of the challenges they too are going through. So we're doing our best as a board, and each case for the most part is confidential. Sometimes families are making it not so confidential. So Dr. Arra's comments and support in what needs to be done is very much appreciated. So thank you.
Wonderful. Thank you, everyone, very much for those responses. So there is a couple more questions in regards to face coverings. I think we've alluded to responses, but because they are here, I do want to ensure that those people listening do hear an answer to the questions that they have submitted. So can we explain why it has become mandatory for children within grade 1 and 3 to now have to wear face coverings, where before those in grades 1 and 3 did not have to wear face coverings. What has changed, or why the change in these rules?
So that's a really good question again, and it's not intuitive and shouldn't be intuitive. Any public health intervention usually has multiple facets to it. We use frameworks that include legal, ethical, technical, and all these variables would come into place. The decision is made provincially. I was not at that table, but I trust our provincial colleagues to have considered all these things. Probably that decision was not made for areas that were in the green or the yellow, like Grey Bruce. They were considered for areas where there were outbreaks everywhere, or multiple outbreaks in schools in other part of the area of the province. So you look at the science, as I mentioned, the best practice is to encourage using mask in any age, whether young kids or older kids, because that's where the most net benefit is. To the best of my ability to understand the decision, is one of it is related to that outrage factor. If people are going to be upset for reasons whether they're related to real risk or not, one way to manage this is to have the word must. So if the parents are using or not using medical exemption appropriately, and trying to contest the system, or trying not to be collaborative or work with the collective of people who are working on the pandemic, whether in schools or public health, this is an easy tool to say, no, you cannot be in the class. And it's easily, rightly so, because we don't want to spend hours and hours and medical notes and going to family physicians and healthcare providers to provide notes. So having the word must would ensure that everybody would follow the right thing. And if not, they will be offered other options: wearing a mask, face shield, remote education, online education, and others. If I want to summarize it, the best evidence practice is to encourage, and that's my recommendation to the schools. However, on top of that recommendation based on risk, there is also recommendation based on outrage. If the need to maintain the relationship between all partners and ensure everybody who's working with the school, from the parents, from the community, is at ease, that word must would become very easy, instead of issuing orders from the health unit or getting in conflict with the school and others. And again, it really is important to remember to be kind. Many people might see other kids not wearing masks. Just be kind. There is a reason. The school is working with public health and with the other parents, and it is confidential. We're not going to put everything online for everybody to talk about. So rest assured, like this question said, how come there is mandated mask in grade 1, 2, 3 right now when it was not necessary? There are reasons to it other than risk, but it is for the collective good and the collective response for this emergency.
Thank you very much, Dr. Arra. Last question regarding masks for this time, and it should be a fairly brief response, but should parents wear masks or face coverings when dropping off or picking up their children from school?
If somebody's sitting in their own vehicle with their family, they don't need to wear a mask. If they need to be in close proximity with other people, less than 1 meter or less than 2 meters, it is recommended. If it is making people more comfortable to wear a mask, be kind and wear a mask. It's not a very onerous effort and or task, especially in the winter. It really comes quite handy to warm one's face. Again, the risk is not there if somebody's separate, different, away from people, but wearing it can put people at ease and can reduce real risk if the situation changes where some other people are in close proximity for whatever reason it is.
Perfect. Thank you very much, Dr. Arra. So next couple of questions, very good questions regarding testing and consent. So will there be asymptomatic testing for students in Gray and Bruce? And if so, how's it going to work?
No, it's not. Medical tests are medical procedures, are controlled acts. If you look at the Controlled Act in Ontario, you would find a list of 13 procedures. One of them writing a prescription, operating, injecting under the dermis, under the skin, and ordering a test past the nasal cavity. So these should be ordered by a licensed nurse or physician. They're not going to be just blanket for everybody to use, not because we want to have a monopoly on it, because it truly need to be prescribed in the situation where it's going to be useful. Tests in general would require exposure to the disease or symptoms. Any test outside of these is not appropriate. It's not going to add benefit, and it might introduce harm. And surveillance in schools would introduce harm. The pilot done by the Ministry of Education in September revealed that over 9,000 tests were done to identify 2 cases. And if these 2 cases were probed in further, and I do believe they were probed in further, you can find that they could have been prevented by looking at certain symptoms or exposure. We communicated with the ministry on multiple occasions, and universally all medical officer of health wrote a letter advisory to the government in August before the school starts, saying asymptomatic testing should not happen in schools. And we do have the rapid test. We will deploy it, and we are deploying it in different settings where it's appropriate. If there is exposure, to manage a case, to manage false positives, to manage exposure. Rest assured, again, this is a medical procedure, and we will take care of it for the best interest of your kids, of the staff in the school. There's not going to be surveillance.
Wonderful. Thank you very much. So as a father with 2 children in school, I'm happy to hear that as well. So thank you for that response. Moving on to another question, and it's more about if testing were to happen. So this could be testing regarding COVID or anything else, but would testing in students ever happen without parental consent?
No, that's a very short answer. No, it would never happen.
Perfect. Thank you very much. So moving on, next it's more about questions about infection control practices and protocols that might be in place in school. So if physical distancing has been established in classrooms, should children be able to take their masks off in class at certain times? Can we sort of just discuss that? I think Jillian's presentation alluded to the potential response to this, but I'll pass it to you, Dr. Arra.
Yeah, Jillian said it best. It's added layer of protection, and depending on the age and attitude and all these things, having the mask is added benefit. Physical distancing can be ensured, but it could be broken at any point of time. You know, somebody drops a pen and goes to pick it up, and they got closer to somebody, they start chatted with them without any awareness of the situation based on age or anything. I wonder if Jillian want to add a bit more on top of her very good presentation. Nevertheless, I'm sure there's too much there.
No, I agree with you there. Like I said, we like to put as many layers in place as we can. And we know just like masks are subject to user error, sometimes physical distancing can have some slip-ups along the way too. So the best that students can, we encourage them to wear the mask whenever possible. If you can maintain distance and wear a mask at the same time, 2 is better than 1. But there are going to be situations where students will have to take off their masks. So for eating and drinking and things like that, which will be when it's quite important to be mindful of your space and who's around you and try to keep that minimum 2-meter distance. So.
Perfect. Thank you, everyone, for those responses. And I guess on the topic of eating and cafeteria time, or when children are eating without face coverings, perhaps from some of the directors, if you were able to chime in, what practices do you see or have you established within the schools to make sure that kids are as safe as possible while they eat?
So I can start. So one of our layers of protection, of course, is our cohorting. in our schools, so that for the elementary students, they are, when they're eating, allowed to take off their masks, but they are in their classrooms and being supervised by adults. So it's in a controlled environment for them. So that's what we do. And then secondary is a little bit different. For secondary, they are allowed to leave the school during lunchtime. We appreciated the support just during the emergency stay-at-home order. It's been compromised a bit, but we appreciate the support of our staff. And even I know there's an article in the paper about the local police were out to support too in the Owen Sound area anyway. And we had sent a message home to parents just asking them to help support us as a board in terms of messaging to their children the importance of not congregating in groups over the lunch hour. So those are just some of the measures we have in place in Blue Water.
Yeah, like Laurie and Blue Water at Bruce Gray, very similar control measures are in place as we regularly meet together with public health and work through these issues together so we can ensure that level of safety. And I think, as Dr. Arra has alluded to, the data speaks for itself. And I think that speaks to the fidelity that staff have worked to support the measures and ensuring that students are wearing their mask and hand sanitizing and staying as apart as possible. So it's all of those measures put together and students eating in their cohorts and staying in their cohorts. And again, as Laurie mentioned, thank you to the community for their patience as our secondary students came back together again, and we work with them to ensure that they're not congregating in larger groups. So I think it's going well and smoothly, and we'll continue to ensure that our students and our staff are safe.
Ian, I would like to add as well. I echo my colleagues, their comments. We have very similar protocols in place. The only difference being that St. Dominic Savio is one school, and our board goes all the way down to Windsor and London. Therefore, we have the rules apply for all our schools. Therefore, for our secondary level, the students are not allowed to leave during lunchtime. And for our elementary students, the only difference is that there is assigned seating. So the students actually are eating in a specific place at their desks during the lunch hours. I'm sure it's very similar to my colleagues as well. And being St. Dominic Savio, it's a smaller school. Therefore, we're not looking at large amounts of students in our classrooms.
Wonderful. Thank you very much for everyone's perspective on that topic. One piece also that one of our parents did ask is, why have class sizes not been automatically reduced to allow for proper physical distancing?
Yeah, I'll answer that. Why would they be reduced? We have 5 months of perfect record of no transmission. There were cases in schools, but no transmission to other kids or staff in school. Having that social experience as close to normality as we can. It's not going to be normal until the pandemic is over. It's going to be modified normality. So why would we split that class in half, change the social dynamics between these kids for no extra benefit? We already have all the benefit we need. So again, I stand very strongly behind this. We have optimal situations supported by data, and we don't need to change it. And trust me, to all parents there, this is our mandate in public health, to ensure the safety of people, safety of kids and staff in the school. And if there is the slightest benefit or the slightest risk in the equation, we will change accordingly, including going completely to online learning if the need be. But at this point, there is no need.
Wonderful. Thank you very much for that response. So what public health recommendations have been made to the schools in regard to keeping children with special needs and compromised immune systems safe? Is there any difference?
So the measures in the school would work for all. There are different families. different individuals with different health needs and health vulnerabilities, and the recommendation for all these families and individuals to consult with their healthcare provider who would know best their condition. And it could be very well the best decision for that kid to stay at home and have online learning or have some modified activity. It is based on family to family situation or individual to individual. I wonder if the directors would like to add from their own experience about certain families or accommodation there.
Sure, thanks. I can start. So again, as with masking, each of these conversations is individual to each family and to each situation. And as Dr. Arra has mentioned, that some families have opted for virtual learning. So we do have a robust virtual learning school where students can attend. We have over 250 students in that school, and it's going well. So that is an option. Other options are when students are coming into school, if there's other added layers of protection through any accommodations that we can do to ensure that students are safe. And that's all done through the regular programming for our students with special education needs through their IEP development, and then working with school staff to ensure that those safety measures and the special education programs and services are delivered to ensure the safety of the student. So again, it's in dialogue with each family to ensure that each student has what they need in order to be safe at school.
And I would just like to add to that as well. So our measures are the same for all of our students, our health and safety protocols, but just again, real acknowledgement of the staff in all of our schools who support our students, and those, of course, students who have special education needs, because there's a lot of tender loving care that goes into all of our classrooms, and our staff do an amazing job of supporting our children's physical needs and mental and health needs and well-being. So our staff has just been doing an amazing job for, well, they always do, but they've just really done a great job through this COVID pandemic.
Thank you, everyone, for those responses. This next question, actually, Dr. Arra, you alluded to it a little bit prior to, but wondering about, are there different protocols in place, or are there going to be different protocols in place with the increased transmissibility of the new COVID variants?
Like I mentioned in the earlier part of this session, there are measures that are designed to increase the robustness of public health to address the new variants. Most of these have been applied in Grey Bruce in default. And if we get to a point where there is a variant detected or variant spread, we will change the measures accordingly. Most of these new measures are related to contact tracing, where, for example, we test kids after exposure in a school, or individuals, not just kids, could be school staff as well, at the end of the 14-day isolation. With the new measures, we will test them twice at day 5 and close to the 14. Most of these measures, again, trying to find the source of the original case, try to contact trace within 24 hours, all of them are in place. The ultimate measure would be to go to modified learning or virtual online learning. And we monitor this situation very closely. We don't take risks. There are indications from other parts of the province what measures are working or what measures are challenged. And similar to all of us, anyone in the audience, the parents, does their work and they know how to do their work really well. Public health here is a team of experts, and everybody around the table would do their best to ensure that job is complete and there's no risk there with the health of the kids or the staff.
Thank you, Dr. Arra, for that answer. The next answer or question is related more to mental health and long-term impacts. So what is the health unit and the school board doing to monitor the impacts of COVID on the students' mental health? That's part one of the question, but perhaps we'll unpack that piece and then we can get to the remainder of the question.
I can start in terms of our schools and the support that we're providing. all of our schools and all the boards have mental health supports in our schools. We are supported provincially by School Mental Health Ontario. It's an amazing organization that has been really ramping up their support over the times of COVID. They created a provincial mental health toolkit, which includes lesson plans for teachers to support children in their mental health. We in Blue Water District School Board also have some mental health nurses supporting our students, and we've just actually increased the staff of our mental health nurses based on some funding that came from the ministry. And in our board specifically too, school staff are being provided with a comprehensive guide of all available supports in order to support the students who are struggling with any mental health needs. So provincially and locally, we are doing our best to support those needs. We know how important it is and how this has been impacting children in different ways from a mental health perspective.
Thanks, Lori. Just to give folks an update as to Bruce Gray. Again, we work in conjunction with School Mental Health Ontario. We have our manager and our school mental health lead who supports our 5 social workers and 5 child and youth workers, and they all have their complements of schools that they work with, and they manage the cases through our manager of mental health services. It's also important to know for families that there is a direct line to make a referral. So referrals can come in through the school team, but also at this time there's a self-referral form, and if it's on the school site, so you can make that referral, and then the schools and the mental health team will reach out to support you. And as well, as Lori had mentioned, hiring additional staff. We've hired some additional staff to support our virtual school, because we don't know there are specific needs for our families and students who are working from home virtually, and case managing that way. So, and again, working in partnership with our community partners as well, public health being one of them, to ensure the mental health and well-being of our students and staff. We know the indicators are very clear that well-being is an important piece of working through the pandemic, and that's something that we need to support in order to ensure that our students are feeling safe and the school is a safe place for them to learn. Those are some of the resources that we have in place.
If I may, I'd like to just add a few comments in regards to what we're doing at Providence, at Saint Dominique Savio specifically. Our students, they all have access to mental health services within the school. All our schools are allocated a social worker and also a child and youth worker. Therefore, the students have access to them on a daily basis. As well, teachers with the principal will do frequent check-ins, obviously, with all the students. Just check-ins, just in regards to see if there's change in behavior and so on. And if there is at that point, then obviously communication is drawn upon for the parents. So there is actually a direct line of communication between the school and the parents.
Ian, if I may chime in here, in public health, we look at data about health from the community at all levels, at all ages, from different sources. You can appreciate we communicate with the healthcare system on all these levels, and if there is any indication of increased incidence of mental health visits to the ER or any other shape of stress, we measure it, we quantify it, we respond to it. There are sources of input from other partners as well. I meet with the local political leaders, the municipal leaders, the mayors, and on regular basis, with the chiefs of police on regular basis. And many of these pressures in the community would manifest themselves in complaint or charges, or you name it, or not charges, could be warning, could be education, could be responding to an incident by police, or a charge, depending on the situation. So we have all this and we respond to it. And if I may share my screen, I happen to be looking at it right before the session. If I can, if you can see this part, the lower right corner of this graph is the ER visits this is an older report. We received this report internally in the health unit on daily basis. It measures the number of people who would attend the emergency department for mental health and substance use. And this is just one indicator. I was comparing September to now to see the stress factor in the equation. So again, and this is just the UMH. We have a team of 150 people. That's their specialty, to look at the health of the community.
Thank you, everyone, for those comments. And for all parents and families that are watching too, at the very beginning, the very outset of this pandemic, we did identify that mental health was a very important issue to ensure that we could manage. So we did dedicate a specific section to our public health website to ensure that families and parents had all the resources at their fingertips, who to connect with and how to connect with those people. I do just want to remind everyone on the phone, if you are ever in need to talk to someone immediately, please call the mental health crisis line of Gray and Bruce at 1-877-470-5200. Or if you just need to know about services, just call 211 and they'll be able to connect you with whatever services are required. And please have a look at our website. All information is there as well.
Ian, if I may just add a bit more, you provided really good source of support there. There is something about stress, and forgive me getting technical here. The hormone that would be produced in the brain related to stress is cortisol, and it is the cause of that feeling that we have if we are stressed, whether it's related to work or a pandemic or anything. And with a pandemic of this caliber going for 10, 11 months, everybody would experience that stress. Kids would experience it, and cortisol would affect the brain in many ways. One of them is to actually not remember much. You would have a report of kids crying, and you ask them why are you, their parents would ask them, and they can't answer. They just can't. There is another hormone in the brain that does really well to combat that, which is oxytocin. It's the hug hormone. It's a hormone produced by hugging, by snuggling, by reading a book on a couch. My advice to parents who are listening to us, yes, use these numbers on our website, use the material, but at the same time, just spend time with your kids. And I'm sure people do it. They don't need advice from UMH to do it. But during the pandemic, it's really worth investing time into. Read a book on the couch, snuggle, spend some time, watch a movie together. That hormone would produce a feeling of love, content, that would go a long way in helping our kids and all of us weather this storm. And one final point: kids are resilient. We can adapt to things, and we can go over things. They can too, and just give them the support. Focus on what's best for preventing the disease of transmission of the disease, and preventing these mental effect that will come from lockdown. And one final point: that's why our goal in public health is to open as fast as we can, as long as safe. It's not the lockdown, it's the opposite of it.
Thank you very much, Dr. Arra. And just you concluding that statement actually does answer to a point the last part of this question, but are the long-term consequences for students being considered in the development of future or in current public health rules and protocols that are currently in place?
So again, I'm not the expert in the long-term effect on stress, but from public health point of view, we are the expert in ensuring that balance between risk of transmission of disease and risk of effect on mental health long-term is struck. And that's why, again, we open as fast as we can. And the success in Gray Bruce is related directly to everybody's effort around the table. It's not just public health or the school or the hospital, it's all of us. The public does the heavy lifting, and I'm sure we're going to be doing our best, continue to do our best where we can end this pandemic, and the stress of it will be behind us as we go forward.
Thank you for that answer. So next question is actually regarding the vaccine. So what does the vaccine rollout look like for education staff, students, bus drivers, and will the vaccine be mandatory for this group?
The vaccine will not be mandatory. Mandating vaccine is not part of our practice, or that's something our society accepts or even needs. We need 75% of the public to be vaccinated to reach the herd immunity, and all stats would indicate that that's quite doable. The rollout of the vaccine for the school staff, they are considered essential workers in the definitions of this pandemic, and that will be in the second phase according to the provincial plan that will start in April according to current projections. It could be earlier if we get the vaccine in bulk earlier. However, there will be an essential worker category with police and fire and other people who would, our society would not function as we can without their support and help. Regarding school students, currently the vaccine is licensed for 18 and up, or the vaccines that we have. That might change down the road. Regardless, it will be not mandatory, it will be by choice.
Thank you, Dr. Arra. We've actually been able to get through all the categories of questions that have been pre-submitted. So what I want to do right now is just turn it back over to the Board of Health Chair, Sue, if you do have any closing remarks that you'd like to share with the group. And we'll go in the same order as we did before, and Dr. Arra will close it out with some closing comments from yourself once the directors of the Board of Health and the Board of Education have completed their comments. So Sue, I'll pass it to you.
Thank you, Ian. I just want to thank this panel for reassuring everyone about the safety measures that are in place in our schools. The coordinated efforts with protocols and guidelines are working, but we all need to be vigilant. So don't let your guard down. Follow those 3 W's: wash your hands, watch your distance, and wear a mask correctly. And if you have a few minutes, take the time to look at the website, the Grey Bruce Health Unit's website. There's lots of information on there and it's updated daily. And just as a side note, I learned lots tonight. So thank you very much.
Thank you very much, Sue, for those closing comments. And I will pass it over to Ann Edie if you have any closing remarks as well.
Well, I think Sue pretty well covered everything as our chair, but I do want to thank everybody for participating. I want to thank those people for listening. I too found it very informative to know some of the details that occur in our schools on a regular basis. And I know many young parents and students, just by virtue of living as long as I have in the same community or the same area. And I feel very confident that the necessary processes are in place. It's great for kids to be back to school. I worry about children if they can't be in the school setting. It's one thing to try and learn online and at home. It's very difficult to replace the actual school setting. And I do worry about some falling behind. And so I do hope there's, at whatever level, that some more remedial education is laid on. I know the regular classroom teacher can only do so much. And so for those students that are maybe struggling, if just due to being out of school, especially in, I would say, primary grades, but it can happen at any grade level. So that's one thing that I would like to hear about in the future. Right now, we're concentrating on safety, but I'm sure there's some children, just with the lockdown last year, if they were in grade 1 or 2, online learning for a lot of little kids just won't fill the gap. So hopefully they'll catch up, but maybe we can, I'm quite confident at the school board level you will look at that once we get through the main part of the pandemic. So thank you for including me tonight as vice chair. I thought maybe just Sue would be coming tonight. And keep up the good work, everybody, and collaborate. Continue to work together. That's key. Thank you.
Thank you so much. And for now, I will pass it over to Lori Wilder for some closing comments from the Blue Water District School Board.
Thanks, Ian. I would like to once again thank Dr. Arra and Grey Bruce Public Health on behalf of Blue Water District School Board. I know that we also join our other school board partners in our appreciation of this opportunity to discuss safety in our schools during this pandemic. As always, we will continue to follow the latest public health advice when it comes to adapting our health and safety protocols in our schools and work sites. And I know that many new measures implemented since the start of the school year have been a big adjustment for all of us. However, I cannot emphasize enough just how proud I am of the high level of cooperation, support for each other, and adaptability among our students, staff, and families during what has been an ever-evolving and fluid situation. As Dr. Arra talked about kindness, there has been a lot of kindness shared across our board. If there's a silver lining in all of this, it is how everyone has come together in the face of adversity. The amazing work and role modeling by everyone in all of our local school boards and communities are evidenced by the consistent routines and responsible actions we continue to see on a daily basis. Thank you to all. With the arrival of vaccines in Bruce and Grey, we very much look forward to the time when we are able to assist with the process for student and staff vaccinations. In the meantime, we will all continue to do our part in working together for the common good of our school communities. Let us all remain hopeful. Thanks again, everyone, for participating this evening, and to Public Health for coordinating and hosting the session to address our questions. I know that our families and local school boards truly appreciate these opportunities. Thanks very much.
Thank you very much, Lori, for those closing remarks. And I will now pass it over to Gary O'Donnell from the Bruce Grey Catholic District School Board for some closing remarks as well.
Thanks, Ian. Again, I thank you for joining us this evening, for your thoughtful questions and for your continued support. I know, as has been mentioned here tonight, if we all work collectively and ensure that we're following the protocols, self-screening, mask wearing, social distancing, I know that we can continue to keep our schools safe and ensure that we keep them open. But it is going to be our collective effort, and through that collective effort, it would allow us to do so. And I think Dr. Arra addressed one of those literacy concerns when he suggested that one measure that you can take is just to get a good book and sit with your child and cuddle on the couch and read a good book. So I think we have a literacy strategy already mentioned here today. And I know, Dr. Arra, that brings joy to our elementary educators, and I can hear our librarians cheering all across the counties. So what a great suggestion to end on a positive note. So Dr. Arra and team, thank you again for hosting this session. To our families, thank you for your continued patience and support as we collectively work to support our students and ensure that our schools are safe for our students and for our staff. Have a great evening, everyone, and thanks again.
Thank you very much, Gary. And now I'll pass it over to Jean-Paul Gagnier, Superintendent of Education for Providence Catholic School Board. Feel free to share some closing remarks as well.
Thanks, Ian. To our listeners this evening, thank you for your questions and the rich discussions that followed. I hope this session provided you with some answers, or at least some valuable information with which you can make decisions on behalf of your children. Communication between the school and parents is key to ensure the safety of your child. Any parent or community member wishing to go over any of the information provided this evening, but in French, you're more than welcome to contact me at the office. A sincere thanks to our partners for organizing this evening, and we definitely look forward to a continued close collaboration with everyone. A sincere thank you, Dr. Arra, for your guidance and your recommendations this evening. It was very informative. And again, thank you, everyone. Have a good evening. Merci, bonsoir.
Thank you very much, Jean-Paul. We will pass it over now to Dr. Arra for some closing remarks from the health unit, and I will just close it with a reminder as well about we will be releasing the video link as well as a frequently asked question or Q&A document. More than likely next week, we will distribute that to the school boards for distribution to all parents and families, as well as posting it on our website and our social media accounts. So without further ado, Dr. Arra, I'll pass it to you for some closing remarks for the evening.
Thank you, Ian. Thank you, everybody. Even the closing remarks were very informative. I echo what Mayor Edie mentioned about the disadvantaged ages for virtual learning. I'm going to just circle back to one of the questions there. Why, if we have online capacity, why do we go to in-person? And that's one of them. And there are other disadvantaged families that are well off can provide online learning. Families that are not as so might have kids that would struggle with it. The age is another factor. Younger kids don't do well with virtual as much as in person. And there are many factors. One of them is the fact that school system is one of the early indicators of abuse, which unfortunately still happens, and having that in person with identified earlier. The closing remark from Mr. O'Donnell is again very, very useful. There are libraries there, and they provide books, and that is, again, I will add to my recommendation. There are books out there. Snuggle with your kids and read a book. And just to finish it, I would echo what everybody said. We have optimal collaboration, optimal kindness, and we really need to capitalize on that. And I want to thank every parent, every school staff, everybody around the table for the great work we're all doing. I've never felt privileged to be part of a team, whether it's the health units team here or the bigger team in Grey Bruce, to achieve the safety for our residents and allow us to go further. Let's double down, stay the course. The vaccine is around the corner. Thank you all.
Thank you very much, everyone. That concludes our evening session.